All right. Good evening, everybody. Thank you for joining us. Tonight is a webinar on concussion prevention in hockey. Very excited to have several esteemed experts with us this evening to talk about this very important topic. Before we get going with our great panel, I just a couple of things. First off, want to invite anybody to submit questions to the Q&A at the bottom of your screen. That is the best way to interact with our panelists. And at the end, we should have just a minute or two to go through questions and answer those from the audience. So with that, I want to take a few minutes here to introduce everyone. Joining us tonight, we have Josh Storm. Josh is the current head coach at Owatonna High School, has been coaching high school hockey here in Minnesota for 16 years, and has been charter member of our Minnesota Hockey Player Development Team, very involved with our checking clinics, as well as serving as a coach-in-chief for District 9 down in southern Minnesota. So Josh, thank you so much for joining us. We also have Dr. Aimee Custer from TRIA Orthopedic. Dr. Custer is a clinical sports neuropsychologist and is in charge, she's a clinical director for the TRIA Sport Concussion Program. So she has a ton of experience working with athletes of all different sports, but particularly in hockey, ranging from the youth levels all the way up to professional, including the Olympics. She's worked with the Minnesota Whitecaps and consults with the NHL. So very grateful to have her expertise and experience with us this evening. Joining us as well, we have Dr. Thomas Buckley, who is an associate professor in the Department of Kinesiology and Applied Physiology at the University of Delaware, where he does extensive research on concussions and head impacts. So very much kind of our guru this evening from a research standpoint, and we're very grateful to have him joining us all the way from the East Coast. So Dr. Buckley, thank you as well for joining us this evening. To kind of kick us off, want to start from the hockey angle in terms of training and coaching and the things that have been done and that we try and continue to do to educate our players, parents, and even coaches in the game in an effort to make the game safer and limit concussions. So, Josh, you want to talk a little bit about some of the areas that are really being focused on from a coach education as well as just coaching players?
Absolutely. Thanks, Derek. I appreciate that. From a coaching perspective, it's just really important to understand how our game has changed, and the speed of everything is so much more than it was 5, 10, 15 years ago. And when you start talking about the speed of our athletes and the size of our athletes, that means that they're going to have less time and space to react to those body contact type situations. So it's very critical as coaches that we take our practice time to make sure that we're preparing our players from the very beginning of their U6, U8 time on the ice, and help them to get as comfortable as possible with body contact. And there's a lot of different avenues that we need to make sure that we're focusing on when it comes to body contact. One of those things is just the comfort of, bumping shoulder to shoulder. That happens whether it's a checking game or a non-checking game. And to put the players into as many situations where they're safe and in those type of contact situations is just very beneficial. With the ADM team, had the opportunity to work a little bit with the checking clinics and really found that the big thing that we taught was start close and slow and expand from there. So we're starting with our body contact in a nice, close, safe proximity. We're teaching them the key points to contact, whether it's checking or just bumping with U6, U8 squirts, peewees, and moving more out from there. And one area that we spend a lot of time creating those contact situations is small area games. Small area games have kind of revolutionized how we do coaching in a lot of different avenues, whether it's skill, whether it's contact, and just those smaller spaces really help our players to create those contact situations. And when we create those contact situations, what we're doing is we are building from there. I had the opportunity opportunity to do a squirt team for the first time in my career this year. And one of the things we focused on week one was bumping. And we talked about bumping and how to bump correctly and a respect in the game and how bumping isn't to intimidate. It's not to hurt. It's not to build momentum. Bumping is to be able to get the puck, and it's putting your hips on another player's hands so you can control the hockey puck. And I think the days of big hits in hockey have kind of started to go away because what usually ends up happening in a big hit is the puck actually ends up going through, and usually the other team ends up getting that puck again. So it's controlling our body, it's keeping our sticks on the ice, it's using our stick play and then our hips to hands to take the puck and be in possession, because possession is everything in this game. I think coaches are really responsible for creating an environment of respect, especially at the hitting levels. And we have to prepare our players to take care of the other teammates. We have rivals and we want to win games, and that's great. But there's also respect to the teams that we're playing, because without the other teams, there wouldn't be any game to play. And then I think the last thing that's really important is we teach kids how to take hits. We have to help them be anticipators of the game, to teach them to roll and kind of get off of hits rather than taking blunt force. And I think a really important part of it too is just making sure they understand how to play around the boards, getting your hands up to protect yourself, not allowing your body to be flat against the boards. Those are all some key points to it. And always just staying out of that danger area, which we kind of consider that 3 feet away from the boards, because that is kind of that spot where the bad things can happen. And I think the final thing to preparing our players, inside those checks, and sometimes things will happen, and they have to be able to understand the safe way and the correct way to go into the boards. And that's getting our hands up, especially when that hit comes from behind, and making sure our face is always up and never going head down, and really trying to keep our heads away from the boards as much as possible. I think it's just something that we all have to really focus on and teach.
Yeah, Josh, you touched on it a little bit, but and from a coaching aspect, we hear a lot about hockey sense within our game, and primarily from a performance standpoint. But when you watch the elite players in our game, they're never involved in big hits, big collisions. Can you talk a little bit about the role of hockey sense in terms of a safety and cultural standpoint of the game, and what kind of impact that has and what you see at the high school level?
Absolutely. I think that, we all want our players to play smart hockey and have that great sense, because it usually leads to goals. But there's so many times where that hockey sense has a lot to do to keeping players safe as well. We have a player that I can think of on our high school team, and he's about 5'9". He's one of our best players, and he just never gets hit hard. And its ability to move, to adjust, to kind of have that sixth sense of when somebody is coming after him to hit him in kind of a negative way. But I think that can be trained as well. And I think those small area games are kind of areas where we can really train people. There's other things out there as well that we can use to create hockey sense and build those kind of habits in our players that kind of make them successful and help them to be safe. But I totally agree when you say that, those best players rarely get hit hard, because they find ways and they're finding better spots to be on the ice where the big hit necessarily doesn't happen as well.
Well said. Well said. Thanks for covering that. Talked a lot about that on ice prevention. There's also some areas off the ice from a prevention standpoint. Dr. Custer, do you want to talk a little bit about just what that means to you in your role at TRIA and some of your expertise?
Yeah, absolutely. Josh, that was wonderful. I think there's a lot of discussion about changing the culture of concussion. And I think, just from my perspective, clinical perspective, or even maybe some of the researchers' perspectives of looking at preventing concussion and increasing concussion awareness, I think sometimes we forget about maybe changing the culture of contact, or we're really looking at changing the culture of checking and making it safer from that, not necessarily avoiding contact or eliminating contact, which I'll talk a little bit about here too as I get going. But I do want to talk about prevention in a couple different realms. And I think a lot of the times when we we consider prevention of concussion, we automatically think a lot about different devices or equipment, different gadgets that are out there. And I get so many things proposed to me all the time is that, let's, if we can have athletes use this device, this is going to reduce concussion. A lot of the things that parents ask me are, if I get the best helmet, is that going to prevent the concussion? If I get the right mouth guard. And those devices do an excellent job of reducing things like skull fracture or more severe injury, particularly dental injury. Absolutely wear that mouth guard. But those devices are not going to stop the brain from moving inside the skull. And that's what causes concussion. And also too, concussions are not just caused by a direct blow to the head, right? So we can have contact to our body, our neck. And in that instance, a helmet or a mouth guard is not going to do anything protecting the brain from that standpoint. There's been a lot of programs out there that looks at neck strengthening, right? And can we strengthen those necks to, again, absorb that hit, be ready for that hit? And that's great. That works really, really well for those anticipated hits. But a blindsided, unanticipated hit, that neck, I don't care how strong your neck is, it's not going to stop or prevent that concussion. And in the last 5 to 10 years, I think there's been this really, really big push of looking at how do we educate players, coaches, parents on just concussion awareness. Right? There's a ton of policy development, player safety, making sure we're wearing the equipment right, looking at legislation and just education on what are the signs and symptoms of this injury. And there's been recent studies that have come out in the last 2 years looking at, are all these efforts really reducing the incidence of concussion? And what we're finding is no, it's really not. It's not actually reducing the amount of concussions that occur. Clinically in my role, this concussion awareness absolutely reduces protracted recoveries. It reduces the chance of athletes playing through symptoms, maybe some of the severity of these injuries, but we don't see the incident rates necessarily going down just from that awareness. And so I think it's good always that we want to bring awareness. I'm not saying we should stop this education by any means, but when we bring our awareness to dangers or different injuries, we have to make sure that we have some kind of solution to it, right? Otherwise, that increased awareness can often lead to maladaptive avoidance or maybe maladaptive behaviors. So I will see a lot of parents actually wanting to pull their kids out of sport or avoid playing altogether just to reduce the chance of concussion. I also see a lot of athletes when they're being inundated with all this concussion education that it can lead to avoidance or ignoring. They might rely on their helmet saying, I've got the best helmet. They got this false hope that that's going to protect them. Or I also see a lot of athletes now playing scared. They're very hesitant. And we know that that's an increased risk for any type of injury on the ice. So we don't want that. But we want to make sure that we increase the awareness in a good way. So I think if we can increase concussion awareness in a different light, what if we gave them a solution, right? Kind of what Josh was alluding to here too, is how do we increase that ice sense or awareness so that we are anticipating or aware of those hits and being ready to absorb any of that contact? Because again, when I hear a lot of this fear going around with concussion, many parents will pull kids out of play. And I think it's based off of good intention, to try to avoid having a concussion. But I think they're missing out on a lot of the other evidence for the benefits of sport, right? So it's not just physical activity that sport provides for us, right? It's this development of discipline, motivation. It's working as a team to achieve a goal, right? It's inclusivity. It's developing healthy habits, routine. And when we really look at what are the long-term, or the risk factors, I should say, what are the risk factors for long-term neurodegenerative disease, things like dementia? What we find them to be is actually high blood pressure, diabetes, obesity, sedentary lifestyle, anxiety, depression. What's a perfect prescription or formula for warding these things off? Sport, right? Or playing in a sport. And so, again, when we look at ways to reduce these risk factors for protracted recovery, or for these long-term effects, sport is excellent. We also see in research that playing sports reduces or is a protective factor against things like depression, stroke, cancers, even suicidality or suicide in itself. And I don't know what parent wouldn't want to reduce that for their kid. We also do not have any evidence that a single concussion is going to lead to neurodegenerative disease or neuropathic changes in the brain. Okay. I also will see this argument of if we just take checking out of the game, right? If we just take contact out of the game, that it'll be fine. Well, if that was the case, then I would see a lot less female hockey players in my clinic, right? And when we look at incidence rates of concussion, so the number of concussions that occur across exposure to sports, we actually see that female hockey players are 2 times more likely to sustain a concussion than their male counterparts. Female hockey players are actually 2 times more likely to sustain a concussion, or 3 times more likely, excuse me. So female athletes are actually 3 times more likely to sustain a concussion than American football players, which I think is very shocking, right? And there are different reasons why that is, and I'm not going to go into all the different sex characteristics that lead to maybe higher incidence rates for females. But I will say, with my experience of working with female and male hockey players, my female athletes that have played in co-ed leagues or with male players on teams, they have a very different ice sense, very different spatial awareness. They avoid hits, absolutely. Josh, you even alluded to this too when we were talking about younger athletes, right? And really getting them aware of their ice, getting their eyes off of their skates and focused on just balancing on the ice, but really what is the whole sport about? What is that contact? And what's the whole ice out there? So I definitely think concussion awareness and prevention, super important, but maybe we take a little bit of different spin on that concussion awareness, preparing athletes better on the ice to take that contact or avoid contact, and play smarter in that sense as well is really important.
You know, that's fantastic. Some really interesting statistics you shared with us there, Dr. Custer. You know, just you know, a quick follow-up question from you know, you talked a lot about, you know, the value of sport and gender differences and things like that. Have you seen differences, you know, or value across sports? You know, within Minnesota Hockey, we talk a lot about the value of playing multiple sports and the transfer from different sport to different sport. Is there a value potentially in terms of just general athleticism and awareness and body positioning and things like that that might actually help prevent concussion along those lines?
Yeah, absolutely. I think that's a really important point. There's been a lot of work that's looked at sports specialization, and that field really, again, highlights the benefits of multiple talents, of having that spatial body awareness, muscular control. I also think that it helps with just a variety, mental flexibility, understanding things in a variety of ways, and hopefully also reducing kind of sport fatigue or over specialization. So I think there's a lot of important factors that go into that, but absolutely those that train across sport, I see huge benefits.
All right, so now we're gonna transition from the clinical side over to more of kind of the research side of this, and just dive into head impacts within hockey, and what we're learning. Dr. Buckley has a fascinating research study through our partner. We're one of our really important partners in hockey with the Hockey Intelligence. So Dr. Buckley, you want to let us know what you've been finding out recently?
Sure. Thank you very much, and appreciate the opportunity to talk tonight. Just to kind of build on some of the great information Dr. Custer provided there. She made a great point that we have no evidence that a single concussion has any negative long-term effects, and that's really important for people to understand. Where we start to worry about some of these long-term effects is really from just getting hit in the head over and over and over again over a number of years. And so the idea we're trying to look at now is really primary prevention. And so the best hit that occurs is the one you don't get. And so if you don't get hit, then you're not going to experience those things. And so, as we talk about different prevention strategies, well, how can we do that? There's been a number of things tried in hockey that Dr. Custer mentioned some of. In terms of neck strength, I wanted to build on that for a second, because she's absolutely right about, the strongest neck in the world won't help you if you don't see the hit coming. But if you do see it coming, if you're not contracting in the right sequence at the right time in the right order for the neck to stabilize, the strongest neck's not going to help you if it's not firing the right pattern. And so it brings us this idea of what we call dual tasking. Can you do two things at once? Can you, for some kids, walk and chew gum at the same time? That's why we play sports, to get better at stuff like that. But the idea of can we do a motor task, skate with the puck, stop, etc., while also having awareness and thinking, knowing where my teammates are on the ice at the same time. But not only that, but knowing where the other team is. And so that brought us into a study we did here. And Derek, if you want to bring that slide up, what we did is we used the intelligent program, and we actually instrumented two youth hockey teams that we have in our area. One of them, it was a U16, and the other was a U18. And we divided them up equally per team. And each team, half the team did the intelligent program for 20 weeks, and the other half of the team did not. They watched hockey videos on YouTube of big goals. We didn't do big hits on purpose, on goals that were scored and on great passes and things along those lines. And we actually put what's called accelerometers or sensors inside the helmets. And so we're able to measure how many impacts each player took. We videotaped all the games and practices. And one of my poor graduate students had the great joy of actually rewatching every one to actually count the number of hits. And so what we saw here on the left-hand side of the screen where it says head impacts, the first two bars, the red and the green, and so red is the intelligent program, and the green is the group that did not have that. In the first 10 weeks, there really wasn't any different. Both groups each player took about the same number of hits during the course of those first 10 weeks. What you notice is in weeks 11 and 20, so when the intelligent program or the cognitive dual task training program kind of quote unquote kicks in, you see a substantial reduction. So you see that the yellow line goes down. And so they actually fell about 300% in the number of impacts they experienced in the course of a week. Whereas the green group, which is the control group that watched YouTube videos, stayed pretty much the same. And since these are the same teams, same practices, same games, it wasn't like the team in red, didn't hit in the second half of the season on those lines. We divided each team up equally. And so that was kind of an encouraging finding. And so the other part of this is not just how many times you hit in the head, but how hard do you hit in the head. And so the graph on the right is called cumulative linear acceleration. So that's really saying how hard did you get hit and how many times did you hit that hard. And so summation. So it's how many hits and how much it was. And we measure what's called G-forces. You're probably familiar with G-forces. So we all live under one G-force at all times, which is the force of gravity pushing us down. And then an average hockey impact is probably 25 to 30 Gs. This is a pretty standard hockey hit. Concussions tend to occur up around 100 Gs. There's certainly some that occur higher and some that occur lower. And so the thought is it's either the number of head impacts or what's the total acceleration that your brain experiences over the course of the season. And what's interesting here is, once again, the results really look the same. In those first 10 weeks, we see that the two teams are basically the same. And again, we divide each team in half. And the second half of this, the group that was using the intelligent program had a substantial reduction in the amount of acceleration to their brain or to the head. We measure the head, not the brain, to be clear on that. The amount of acceleration to the head relative to the group in green, which had no change at all. They were pretty much flat as can be. And so that decrease in the total acceleration to the brain, to the head, which is probably the most important thing to protect the kids in the longer term, is probably driven in large part by just getting hit less. And when you do get hit, if you have a greater awareness of what's around you, you see it coming, then you're able to use those neck muscles that Dr. Custer helps you build, and hopefully better timing And so that way we're able to reduce the effects of this of these impacts. This study's been published, and you actually see it right down in the bottom right-hand corner. So if you can Google it, it's actually free online. So it's, if you actually want to learn more about it. And so the thought process we have here is simply, if we can have better awareness of our surroundings, if we can have better dual task capabilities, understanding both where we are in space, or as the coach pointed out, Josh, much more eloquently, keep your head up while you're skating. As opposed to keeping your head down, looking at the puck as you skate through the center ice. If your head's up, you're aware, you're less likely to get hit. And if you do get hit, hopefully it will be a lower impact of that hit. And so our hope is this is one strategy that might be able to help reduce the burden of head impacts over the lifetime. One thing Derek didn't tell you about me is I played hockey for 15 years. I'm a proponent of hockey, so I'm a scientific researcher, and I do study head injuries. But I'm also a Boston Bruins fan and a hockey fan. So maybe hope they'll hold the Bruins part against me.
Definitely won't hold the Bruins fandom at with the guys they have out there. It's hard to blame you. So a quick follow up. I have a feeling that a couple of our audience may be just curious. What Intelligem is and why it would potentially have this type of impact on increasing awareness and helping us in this way. Just want to make very clear that Intelligem is not some sort of a hockey video game. Could you elaborate a little bit, Dr. Buckley, on just what it is and why it would have this type of an impact on reducing head impact so significantly?
So it is a computer game, and that's the nice part of it. So the kids actually, for the most part, enjoyed it. It's a very challenging game, and it's based on a number of stimuli being presented on the screen simultaneously. And so this comes back to the situational awareness, or your ability to dual task, where you know where your character is on the screen, but you also have to be aware of where the other characters are on the screen. And it comes out of the Air Force, and so the bad guys try to bomb you in the game, and so you need to overcome that. And if you and so as the game progresses, it becomes harder and harder, like any other video game. But it's training your ability to cognitively and motorically dual task simultaneously. So you have to be able to move your person while maintaining an awareness of the people around you and what's happening around you. And so the goal as it works through is to really give you greater situational awareness. We weren't able to study that situational awareness directly. That's a more complex scientific approach. And so we went out into the rink instead and just said, does this actually reduce the number of head impacts that occur? So that was kind of the approach we took.
Fantastic. Thank you, Dr. Buckley. I think that helps a lot. Some of us are pretty familiar with the program, but it is good to verify that. And it's funny when you talk about situational awareness. It sounds like a really fancy term, but essentially that's what hockey sense is. It's the ability to perform skills while being very aware and in tune with your surroundings and making good decisions at the same time. So a lot of things going on there at a very high level and in very short amounts of time. So with that, we have time for just a couple of questions. I think we might have a couple coming in via the Q&A. Before we do, Dr. Custer talked a little bit about gender differences in sport and particularly in hockey. Coach Storm, do you want to touch on a little bit about just teaching body contact and checking and those skills within the girls' games, because they are at times overlooked?
Absolutely. I haven't had the opportunity to coach a ton of girls hockey myself, but I am lucky enough to share an office with someone who is in the Hall of Fame for girls hockey. And he and I talk about this quite regularly. And I've always said from day one that I would have the most physical girls hockey team there was if I were a girl hockey coach. And that doesn't mean that we'd be taking penalties or be cheap, but I just feel that body contact is such a tremendous way to defend when you don't have the puck. And teaching players to come across hands and use their stick effectively and take away time and space in the parameters of the game, whether it's on the boards or off the boards, is just so crucial. So I think that All those things are really important. I think that girls need the same exact experiences as the boys all the way through. And you're working, with Bantams being that first level of checking. That's kind of where the boys are starting to get the real game time checking. We should probably be working at it in peewees and stuff like that and practice. But once they get into the game is when we kind of have to worry about checking. So most of their careers, they're playing with the same exact rules as a female player. And it's really important that they're being taught how to protect themselves, how to stay away from those danger areas, how to not put themselves into vulnerable situations, but also how to you take the body inside their rules. And they can be taught to wrangle and angle and push to the boards just like the boys can, as long as they're using the kind of hips to hands approach and stick to stick.
Awesome. Thank you. No, that is right on. I think anybody that has seen higher level of women's hockey, whether it's watching the Gophers or the Whitecaps or in the Olympics, sometimes it's pretty impressive how physical it is. For no check, there's a lot of body contact going on in those games. So, as I'm sure Dr. Custer is well aware. Want to finish up with just maybe one last question here. Dr. Custer, talked a little bit about the different age levels that you're involved with and the speed of the game and the strength of the players as you go up in experience level and you get to those highest. And you would think that, like we see in pro football, that the highest levels of hockeys would have the most incidences of concussion. And while we see some really bad ones, the incident rate doesn't seem all that high. Do you think that there might be any relation between the high level of hockey sense that also occurs and awareness at those levels that may help limit the number of incidents?
Yeah, that's a great question. And that's very accurate. We do, that an incident rate does decrease as that player's ability improves, for sure. And I think it does lead to a lot of that field sense or that ice sense, for sure. And also a built up type of resiliency, being able to, again, anticipate those hits, know how to take that impact. I will also say that as players proceed kind of through their careers, I'm thinking of what's the best term, I guess, but with some of the weaker ones, I don't mean that in necessarily physical sense, but they kind of get weeded out, unfortunately. So those that carry a lot of risk factors for concussion or complicated recoveries from concussion persistent symptoms, be it other migraine, ocular motor disorders, maybe a number of concussions or incomplete recoveries, we don't see them really going on or continuing their career. And so there is a lot of resiliency, I think, that's built up, or that we've got some of the most resilient players in that professional or Olympic performance.
We did get one last question here in the Q&A that I think we have time to cover this quick. Specifically, a question to Dr. Custer here. Are you saying that there is more concussion in women's hockey, at least somewhat, because they don't have as much experience with body contact and hitting, and may lack the awareness that goes into some of those skills? Could you just clarify that?
Yeah, I would say that it's probably a factor. There's not sound evidence. In fact, there needs to be a lot more research just done on the female athlete, because there are risk factors females carry hormonally, definitely from a neck strength standpoint as well. Females are also more likely to have some of those risk factors for concussion, such as migraine or anxiety disorders, depressive disorders to run a little bit more prevalent in female athletes. And so, no, I can't confirm that we definitively say that this is 100% because they don't have that awareness. But more studies, I think, would start to reveal that is there. And I absolutely see it clinically. I see it in my practice and again, in my experience. When we have that improved awareness, that plays a big role. I also say some of the most effective treatments I have for concussion are a lot of these dual task programs, vision therapy programs, cognitive programs that we do really when we have some of these concussions to try to make sure these athletes are not only ready to get back on the ice, but how do we build their resiliency to not have that repeat concussion? And so very, very effective to be looking at some of that ice sense, spatial awareness, dual task stuff as well when it comes to this population.
All right, and looks like that's kind of the end of our questions, and we're kind of towards the end of our time here this evening. So I want to wrap up and once again just take a little bit of time. Thank you to all of our panelists so much for sharing your expertise. It's not too often that we get the opportunity to bring together the on-ice component from a training and development standpoint, the clinical side of it, concussions, and then also what's happening in the world of research and what we're really learning in this ever-evolving field. So thank you so much, all three of you, for your time this evening and for sharing your expertise. We really appreciate it. I also want to extend a thank you to just our player development team in general, who host so many body contact and checking clinics. We will have a few more of those this spring. And want to thank our Minnesota hockey partners in TRIA Orthopedic and Hockey Intelligence for not only the fantastic services that provide on a daily basis to help with the development and health and safety of our athletes, but for taking the time to lend their expertise to our families even before those occur. So thank you so much to our partners as well as the panelists. We appreciate your time and hope everyone has a great evening.